Hello, I'm Anthony Carroll, AARP Iowa Advocacy State Director. I'm here on behalf of AARP with 380,000 Iowa members of all political parties over the age of 50 in Iowa. I thank leadership and members of the Iowa House for the opportunity to speak. AARP supports Medicaid expansion as outlined by Senate File 296, the most cost-effective plan for low-income Iowans. 17,000 alone Iowans between 50 and 64 currently lack coverage. Along with my remarks, I'm submitting Kaiser Family Foundation's Faces of Medicaid. This is mandatory reading as a profile of who these proposals impact, and a reminder to keep these people top of mind. This document points out that low-income uninsured Iowans are largely the working poor who can't afford coverage and do not have the option of coverage through their employer. In comparing proposals, AARP is glad to see both proposals commit to improving outcomes for low-income Iowans. However, there are three key reasons why Senate File 296 is a better proposal. Number one, all Iowans making less than $15,000 a year can access local preventive care. Iowans cannot improve their health without access to local preventive coverage outside of emergency rooms and a few other places. Limiting primary care access would force longer drives, a proven problem with Iowa Care, which also hinders program participation. Second comparison is simplicity and workability. Timing is critical with deadlines Iowans face for required coverage. We are running out of time to go through the lengthy federal approval process for new, emphasize new, federal dollars and then establish a new ACO system this year. Last but not least, cost. Our AARP Iowa volunteer state president is in the balcony. He intended to speak, but I'm speaking on his behalf. He wanted me to point out he's the numbers guy in our office. He's a conservative who needs to see how the math works. This is where the Healthy Iowa plan especially falls short. The math does not work. This plan shifts more cost to Iowans. We're concerned about the estimated $20 million more Iowa dollars needed for the first 3 years annually. We're concerned about the estimated $19 million in penalties that Iowa small businesses face by forcing more low-income Iowans into an exchange. Finally, we're concerned about the potential $80 million plus cost shift to Iowa County property taxpayers. We know that 80% of our AARP members own their home. Forcing Iowans to contribute more property taxes is unacceptable. Please come together with a better solution. Start by reconsidering Medicaid expansion, or offer something that sets a bar as high in helping individuals and limiting cost shifts. Thank you for your time.
Thank you.